This is Radio Health Journal. I'm Nancy Benson. This week, how your holiday feast may produce confusing stomach and even lung symptoms.
So things like overeating or drinking carbonated beverages. It's really a perfect storm for reflux the holiday season.
Heartburn and other kinds of reflux when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
I think it really just showed people you can totally be unique and have a really great time and not be judged.
We dive into Food Network's TV series Holiday Baking Championships. Then,
retail items such as frozen chew toys are things that we see a lot of movement on right now.
Christmas is just a few days away. Have you finished all of your shopping? I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Tis the season for holiday parties, dinners, and eating and drinking way too much. No wonder so many of us make New Year's resolutions to lose weight as soon as the holidays are over. But all that holiday feasting can have effects beyond just our waistlines, according to Dr. Jeffrey King, Chief of Gastroenterology at National Jewish Health in Denver.
The big thing around the holidays is where everybody stuffs their stomach with as much food as possible and then goes and lays on the couch and watches football. That's sort of a perfect setup for having pretty bad reflux. Anything that over distends the stomach can make the sphincter muscle relax and make that person more prone to having reflux. In addition to that, often people will have a couple of glasses of wine with their Thanksgiving dinner, which can also loosen up that sphincter muscle. Maybe some desserts, very common this time of year, chocolate-based desserts. And then going and laying down where you actually don't have a gravity working on your side as much to keep all that reflux down into the stomach. It's really a perfect storm for reflux the holiday season.
Most people know what it feels like to have the stereotypical case of reflux. A lot of us call it heartburn. Doctors call it GERD. What most of us don't realize is that a little bit of reflux is normal.
It is normal to have some degree of reflux, but in general, that's just a small amount that comes up to the end of the esophagus and gets pushed right back down into the stomach. When we talk about GERD, that refers to gastroesophageal reflux disease. The D is for the disease. So gastro means stomach, esophageal means esophagus. So it's reflux from the stomach up into the esophagus that causes disease or inflammation, irritation, or damage. And so when that normal amount of reflux either starts happening more than it should, or if that reflux is getting into places such as the airway, the throat, where it shouldn't be, that creates inflammation, damage, and the disease part of the condition.
A lot of people experience reflux more than just every now and then. That's when it can be deadly serious. Esophageal inflammation can even progress to cancer. But it's possible to short-circuit the process by eliminating triggers, such as those in the diet. Many triggers are more common during the holidays. King often asks patients to pay close attention to possible triggers before he prescribes anti-reflux medication.
There are 4 big substances that we generally talk to people about that there is some medical evidence to show that it may reduce the pressure or increase relaxations of that sphincter muscle, and that is nicotine, chocolate, caffeine, and alcohol. And then anything that increases pressure in the stomach can make that muscle relax more during the day. So things like overeating or drinking carbonated beverages, which fill the stomach with air. Patients can really drive themselves crazy with avoiding foods that some article has shown may be related to reflux. And I have seen patients who come in to see me and they've limited their diet so much they're down to eating saltine crackers and water, and they're really not feeling any better. And so what I really try to educate those patients is that triggers tend to be different for every person.
GERD can also be a lot different for every person. For example, sometimes people think they have asthma when what they really have is undiagnosed reflux.
I've seen people who have been told they've had asthma since childhood, may have even been on steroids for 10 to 20 years, unable to get off of them because their symptoms are not well controlled. And when we put them through an evaluation, we actually find that the patients are having a fair amount of reflux that is coming all the way back up to the top of the esophagus. And if it's breaching the top of the esophagus and getting back into the throat, then it's right over the vocal cords or even over the trachea going down into the lungs. And so if reflux is coming back up into the throat above the esophagus, it's certainly possible that it can irritate the airway, get over into the lungs, and cause airway inflammation that can present as symptoms that mimic asthma.
So even with chest pressure and wheezing in the lungs, the problem may be in your stomach.
There are a lot of patients that wind up in my clinic and they're unsure why they're even seeing a gastroenterologist about their asthma issues. But the tip off to me and to the pulmonologist here at National Jewish is symptoms that are not responding to standard treatment. So patients who are given inhalers or who are given a short course of steroids or antibiotics and their symptoms do not respond adequately to that treatment, that should be a red flag. The other thing is symptoms that tend to be worsening over time despite continuing medications, or symptoms that tend to not have the same standard triggers that a lot of people have, whether it's environmental exposures, exercise, things like that.
Most people expect to be prescribed antacid medicines like Nexium and Prilosec when they're diagnosed with GERD, and often that's the case. But King is reluctant to do that when a patient doesn't have heartburn, and instead acid is going all the way up the esophagus.
All of those acid reducers actually do nothing to reduce the total number of reflux events a patient has during the day. So there are studies that show that patients, when their reflux is measured before they're on those medications and then after they're on those acid reducers, that the patient actually has a similar number of reflux events before and after. What happens is those medications reduce the amount of acid that the stomach produces. So what's coming back up into the esophagus tends to be less acidic. Now that's really, really good if your symptom is indigestion, heartburn, or if there's inflammation in your esophagus we're trying to heal up. Reducing the acidity of what's coming back up can be very helpful. But if your issue is more of an airway problem where that reflux is getting above the esophagus and getting onto the vocal cords or down into the airway themselves, simply reducing the acidity of what's coming back up doesn't fix the problem at all.
King says in those cases he'll target diet and weight loss first to help keep the valve at the top of the stomach closed. If those don't work, he may use a couple of medicines off-label that keep the valve closed. Surgery is another option. But King says for many patients, it works to simply avoid eating like every day is a holiday dinner. You can find out more about all our guests on our website, radiohealthjournal.org. Our production director is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
Holiday celebrations are often joyous occasions, but they can be challenging for the millions of people living with Alzheimer's disease and those who care for them. The hustle and bustle of the holidays can be stressful for those with Alzheimer's, and changes in the daily routine, large gatherings, and noisy environments can create extra anxiety. Monica Marino, Senior Director of Care and Support at the Alzheimer's Association, has some tips to make the holidays enjoyable.
First, plan ahead. Prepare the host for special needs, such as a quiet room for the person to rest. If you're hosting, let guests know what to expect before they arrive. Since crosstalk and multiple conversations can be challenging for people living with Alzheimer's, try engaging the person one-on-one or in smaller groups, and keep them involved in the celebrations.
Marino also suggests experimenting with new traditions. For example, if evening confusion and agitation are a problem, turn your holiday dinner into a holiday lunch or brunch. Find out more tips at alz.org.
According to the American Cancer Society, prostate cancer is one of the leading causes of cancer deaths in American men. That's why, for men with prostate cancer at risk of progressing, monitoring for signs of progression is critical.
I'm Dr. Chris Pazanka, a urologist at Associated Medical Professionals in New York who has been paid by Janssen Biotech as a spokesperson. Men with prostate cancer whose disease progresses after treatments like surgery or radiation may receive hormone treatment to lower testosterone called androgen deprivation therapy, or ADT. However, for certain men, prostate cancer can further progress despite this treatment. Prostate cancer that has not spread to other parts of the body and no longer responds to a medical or surgical treatment that lowers testosterone, or ADT, is called non-metastatic castration-resistant prostate cancer, or NMCRPC. Men with NMCRPC are at risk for the disease spreading to other parts of the body. Erleada, also known as apalutamide, is a prescription medicine used to treat prostate cancer that has not spread to other parts of the body and no longer responds to a medical or surgical treatment that lowers testosterone.
In a clinical study, the median time men on Erleada lived without their prostate cancer spreading was 40.5 months versus 16.2 months. Erleada is not for use in women. Use birth control during and for 3 months after treatment with Erleada because it can cause harm or death to an unborn baby. Erleada may cause serious side effects, including heart disease, falls and fractures, and possible risk of seizure. Call your doctor right away if you experience chest pains, sudden loss of consciousness, or a seizure, and go to the nearest emergency room if you get chest pain or discomfort. The most common side effects were fatigue, joint pain, rash, decreased appetite, weight loss, high blood pressure, hot flash, and diarrhea. Tell your doctor if you get a rash. These are not all the possible side effects. Tell your doctor about your medical history of heart disease, seizures, stroke, brain injury, or tumor, and all your medical conditions. If you're concerned about your prostate cancer spreading, ask your doctor about Erleada. For more information, please see our ad in Popular Mechanics. Call 1-877-546-3586 or visit www.erleada.com.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
This is not drama or exaggeration. You can put someone into a psychotic break by going in and doing a cleanup behind their back. And I have seen that happen.
Hoarding disorder and why it's not as simple as just throwing all that stuff out.
Then, incredible advances against one of the most serious cancers of all, melanoma.
I don't use the word cure, and they certainly do not work in all patients. And when they don't work, life expectancy is limited.
All that and more on Radio Health Journal.